Hello everyone, my name is Patrick Nshizirungu and I'm a K+ student who is majoring in healthcare management with global perspective concentration. Today I'm going to be discussing with you what we call electronic health records. One wonders what is electronic health records. Electronic health records refers to the digital version of recording patient health information using either machines and other electronic materials which will be able to adopt and support the softwares which helps to record the patient information, and this will be able to record the patient information for a long period of time so as to refer for the information once there is a need of the information in order to help the patient. So electronic health records comes in after as the transformation from paper records. In the past period, health centers, clinics and hospitals and health organizations used to record patient health information on papers, and this was not an effective way of keeping the information for the patient in order to help them in the future. That is why, due to the development and technology, it is of great importance that electronic health records comes in as a way of helping uh, healthcare providers, clinical support, administration, have the way of recording the information and keeping the information so as once there is a need in the future to refer to the past, to the historical information of the patient, it will be easy for them to access and be able to help the patient effectively and in the right place. So with electronic health records, there are some components that support direct clinical support. On the other side, there are also some components that support the administration in general. Starting with the direct clinical support, there is rooming and measuring vital signs of the patient. This is when a patient comes into the hospital and there is, after the patient has scheduled the meeting and has come to the point of meeting with the doctor, before the patient meets with the doctor, nurses will be around and help direct the patient into the room, and after entering the room, nurses and other practitioners will be able to measure the vital signs of the patient as diagnosing them, and with electronic health records, they will be able to record the information using machines, as there are some they have installed some softwares which will be helping them track the information of the patient's patient health information. On the other side, there is patient examination and documentation. Once the patient has been examined and there is a need of keeping those information so as to help the patient in the future. The only issue with those aspects of rooming and measuring vital signs as well as patient examination and documentation will be once the nurses have recorded correctly the patient information, which will be a big challenge in the future once they don't refer to the information and help while helping the patient while the doctor is referring to wrong information. This will impact patient's health status. On the other side, there are also some components of electronic health records which support the administrative or the administration. One is appointment scheduling and funds collection. With electronic health records, there is a need, of course, of using internet. So patients will be able to make the appointment with doctors while they are at their home. The only issue with this will be once patients don't have internet, and this will be a great issue also to the healthcare providers. Once they don't have internet, they won't be able to know who, if there is a patient who has scheduled for an appointment. But the only thing to solve this will be having an internet for all, which is still an issue for this aspect. There is also check-in and payment. Once the patient comes into the hospital or the health centers, they will be required to be checked so as to know, to be diagnosed so as to know what are the signs, what are the main uh, areas that you need support. On the other side, there is a need of also paying some services that the hospitals are paid for with either insurance or by patients themselves. So with electronic health records, it will be easy to record the information and know this patient has this insurer or this patient pays for themselves. They need to pay this amount of money, so which is also an easy way of tracking the information of the patients. So the only issue with this will be once there is once they enters some information which are not correct, so which uh, will be a great challenge for the health centers. So on the other side, we are going to look for the importances of combining clinical and administrative support at the health centers. With clinical and administrative support, there is proper use of time. If some employees are in administration and their focus is on keeping the financial records, knowing the appointments, getting the meeting with the doctors, this will be able, this will enable the practitioners to focus on their job of helping the patients in a greater way, which is really a great importance for this. On the other side, there is effectiveness of the job. Once there is a combination of direct clinical support and the administration, this will lead to effectiveness of services that are delivered to the patients. This is because with combination of different forces, we give each other ideas on what is going on, what is going well, what is not going well, and give each other feedback, which will lead to the improvement of services that are delivered at the hospitals. So you see, you understand that there is a big importance of using, combining clinical and administration area. So moving to the setback, even though there are some importances of combining clinical and administrative, on the other side, we are also having the great importances of electronic health records. However, there are some setbacks and barriers to this the electronic health records to be successful. This is because there is unskilled laborers. There are in order for the electronic health records to be successful, there needs to be uh, skilled laborers who are able to use machines, computers in recording and accessing the information and be able as well to refer to the information. So if workers are not skilled, this is a great challenge for this electronic health record to be implemented everywhere. On the other side, there is cost of machines. For most of electronic health records to be implemented, there is a need of machines, so those machines can adopt the softwares. So once there is no machines, once machines and are very expensive, this is a limitation for the electronic health records to be implemented overall over the countries in the health centers. Finally, it is of great importance that most clinical and health centers, health institutions will adopt this electronic health records system of recording the information, which will be able to increase the effectiveness, improve effectiveness, and proper delivery of services to the patients. Once this has been implemented, there will be an improvement in delivery of services to the patients. I hope this will be helpful to you and and this information can be used in getting health centers and the patient health information very confidential, and keep the information confidential with full of control who accesses the information and who needs to use this information. Thank you for following this. I hope will be helpful. Thank you.